Healthcare costs rising for millions of Americans next year now that the government is on track to reopen without the extension of tax credits tied to the Affordable Care Act. The health policy research organization KFF reports annual out-of-pocket premium payments for Affordable Care Act enrollees will more than double on average next year, jumping from $888 to more than $1,900. KFF's Vice President Cynthia Cox joins us now. She helps lead their research on the Affordable Care Act. So Cynthia, talk to us about these premium increases. Who will feel it the most?
Yeah, so people who get their health insurance through the Obamacare market, so this is like healthcare.gov or Covered California, you might be buying it directly from an insurance company too. Pretty much everyone who buys their own health insurance is going to see their costs go up next year. But the people who are going to be particularly hard hit are probably middle income people who are losing any eligibility for financial help next year. Some of those folks could see their costs go up by $10,000 next year.
Open enrollment started already this month. Are people seeing the sticker shock?
Yeah, so people are logging on now or talking to their insurance agents and brokers and seeing the sticker shock. On average, how much people pay each month is going to double. I think there are some things that folks can do. First of all, please seek out help if you need it to understand your options. Talk to an insurance agent or broker or navigator. You might be able to switch to a lower premium plan that might have a higher deductible, but that's still probably in many cases better than going without insurance. And I think people who make just above 4 times the poverty level, so these middle income people who are losing their financial help, they really need to be careful to think about how much income they're going to bring in next year, because they also might have to pay back tax credits if they get them and it turns out they weren't eligible for that help.
Yeah, I mean, we know that there are different tiers to Obamacare health plans. As prices go up, do you think people will just downgrade their plans to make something more affordable? What's that look like?
Yeah, I think most people are going to find a way to keep their insurance. We do think that about 4 million more people are going to be uninsured because of the expiration of the enhanced tax credits. But I think millions of people will find a way to keep their health insurance. They might pay more each month to keep a similar plan, or they might be able to minimize their premium increase by, say, dropping down to a bronze plan. But those plans have deductibles that are about $7,000. And so, people need to think carefully about how to balance their monthly premium costs, but also make sure that you can afford to go to the doctor or, have a hospital stay if you need one.
So 4 million people will just drop out?
Those are the expectations. Eventually, that would happen, that 4 million more people will be uninsured. I think that probably at first we're going to see a couple million more uninsured people starting in January. And then as time goes on, maybe people who were going to try to make it work just find that they can't make it work over the next couple of years. So it is a sad reality that there will be more uninsured people, and also just more people facing a lot of financial strain to be able to afford to keep their insurance too. I think that there is a big concern about medical debt too. And so as more people are uninsured or underinsured because they enroll in a plan with a really high deductible, then that can mean that more people are going to experience medical debt and or also have cost-related barriers to accessing the care that they need.
Yeah, I mean, it's really striking just to hear 4 million people will be dropping from health insurance the next couple of years. What challenges do they face? I mean, hospital visits happen, emergencies happen.
Yeah, so I think, this is also coming at around the same time that earlier this year, there were changes made as part of the budget reconciliation package passed over the summer that would leave 10 million more people uninsured. So the United States is probably going to have eventually about 14 million more uninsured people than otherwise would have been the case. That's going to mean that those people still need emergency care. They can show up in a hospital and the hospital has to see them and stabilize them, regardless of their ability to pay. But they might end up in medical debt, and that also could strain the hospital's finances if that person isn't able to pay their costs. And so hospitals are concerned that, especially some of them that are already on the brink of financial, distress, they might have to shut certain services or even close down entirely.
Cynthia Cox with KFF, thank you.
Thank you.